first one was. So the fact that the pulses are not right next to each other, 1, 2, 3, 4, you're not stacking energy. And what does that mean? That means, number one, it gives the skin a critical extra time to cool, so it's less painful. And what does that mean if it's less painful? Well, number one, we don't have to incur any of the risks of general anesthesia or even IV sedation. We can do this procedure strictly with topical numbing cream. And number two, if there's less pain per what? Less pain per amount of energy being used. So if there's less pain, then we can use a little bit more energy per unit area to heat up the dermis. And one thing that we learned for sure with the original carbon dioxide lasers for resurfacing and ablating the skin is that it's heating up the dermis, heating up the collagen. That is what helps us then form collagen and form new collagen to fill in those lines and wrinkles.
I decided to do the laser treatment because I had very sun-damaged skin, very blotchy, brown, the pigment was not, it was all blotchy, and it just, total sun damage from the youth. Different people that had it done, I read about it, online. I did some research that way and saw the before and after results of a lot of the patients. The procedure was quite simple, nothing too dramatic. You come in, you numb up, for 40 minutes with certain numbing cream. They wipe the numbing cream off. Then the procedure is about an hour. It takes that long. I didn't feel anything during the procedure. About an hour afterwards, you felt like a real bad sunburn that you got, but then that subsided within the hour. It was, gone. The next day I went to work, so it wasn't that, you were, it's all the moisturizing that you have to put on it. Your face was a little red, a little swollen, nothing too bad. By the third day, Wednesday, you start to peel. Thursday, the peeling, starts to subside. It's starting to, come, the surface of the skin is looking better. And by Friday, everything is totally peeled off. The new skin underneath, I was slightly red, nothing, dramatic or anything like that. The most important thing is the moisturizing and, keeping it on. So you're really loaded with moisturizer. But other than that, it was, not a bad procedure whatsoever. A big difference is the pigmentation. It's much more clear. The blotchiness is gone. Even skin tone is the biggest difference. Yeah, my fine lines have diminished, around the eye area. Not that I had that many, but it really made a difference as far as the fine lines. I would definitely highly recommend it. Anybody with sun-damaged skin, big difference.
I was introduced to the laser treatment through Dr. Kenneth Mark, and he's a dermatologist that practices in East Hampton, Southampton, and New York City. And I was very impressed with the results that several of his other patients that had the MiXto done, and did a little research on my own and decided that I would attempt this process also. I have very sensitive, very fair skin and a lot of sun damage from years of not really being aware of how to take care of it and to prevent it. And I also had a considerable amount of brown spot damage on both sides of my jaw line, and wrinkling around the perioral area above my lip and on either side of my mouth and chin. And this really was the process that made a great difference. I have no brown spots left. My skin damage was mainly on the lower portion of my face, and the improvement is actually dramatic. So I'm very pleased with it. I just would recommend it. I don't think you're going to have any problem with it at all. Great. I think you'll be delighted with the results.
This is one of the main reasons why I like the MiXto. Relatively painless, can be done completely under local anesthesia without any needles even, just with a cream. Minimal downtime of approximately 7 days, And during those 7 days, there's no pain, or virtually no pain. Everybody obviously has a different pain threshold, but for the most part, it's 7 days where for the first 24 hours, the patient is a little bit pink to red. For the next 2 to 3, 4 days, they're kind of somewhat crusty or scabby, kind of as if you scraped your hand on the asphalt or the concrete. And then for day 5 and day 6, and sometimes even day 7, they're kind of peeling off as if they had a sunburn, just peeling and flaking off. And typically by 7 days, if we did this on a Monday, by next Monday, typically they are completely healed with a new layer of beautiful skin. And besides doing this for fine lines and wrinkles, the other reasons to do this procedure is people who have just blotchy skin and photo damage. It's in essence a laser peel. So it's kind of like a advanced chemical peel, but with the precision of a laser, and you can erase years of sun damage off of a person's face and off of their appearance. To sum up, the MiXto is a procedure that can be done in the office without any anesthesia other than a topical numbing cream. It takes about 30 minutes to 45 minutes to do a full face procedure. We can adjust the amount of energy from the laser for areas around the mouth or the eyes. We can adjust the shape of where the laser beam is coming through, so we can do relatively quickly large size rectangles across the cheeks and the forehead. Then we can change shapes for smaller areas, like such as around the eyelids or the upper lip or the corners of the nose. And it's a very user-friendly, unique machine compared to other carbon dioxide fractional systems. On the day of the procedure, you would show up at my office and be greeted by my staff, my friendly, warm staff, and then you would be brought into a room where numbing cream would be applied. It takes about 10 minutes at the most to apply the numbing cream, and then you wait approximately 30 to 40 minutes, and then we remove the numbing cream and bring you into the treatment room where the laser is, and then we do the procedure. It takes about 30 to 40 minutes. For the most part, it's extremely well tolerated without causing any significant pain. When you're done, we then apply an ointment to your face to soothe and promote healing, and then you go home on your own with no problems. One thing that I really appreciate is coming from dermatology, where again, we're used to dealing with patients who are awake, and in our offices, all these procedures, whether it's tumescent liposuction or Mohs skin cancer surgery or the MiXto fractional carbon dioxide laser resurfacing, have really mastered the art of local and safe anesthesia. And if we can avoid risks of general anesthesia and take one less complication or complicating factor out of these procedures, that's a great thing.